Doctor is in.
Happy Wellness Wednesday, Ricky. The doctor is indeed in. And today we are talking about a topic that I think not enough of us discuss and
Right,
not enough of us know enough about. And
right.
we're talking about bone health. We're talking about osteoporosis. We're talking about vitamin D, metabolism and deficiency, and all of the things that surround how we take in vitamin D, what it does with our immune systems, how it helps our bones, and what to begin to do about it. So this is a great conversation today because the sun is out, it is gorgeous, and people are out working on their tans, they're metabolizing, getting that vitamin D, some more than others, and
Right,
we got to talk about it today.
right, right,
Absolutely.
right, right. And bone health is a silent disease. Bones are silent. So they're in there and we don't really know what they're doing. And we just take them for granted. You just take for granted you're going to get up out of your bed every morning and walk and, move your body across the floor or whatever you got to do. And we don't really think about it. We don't really think about it. And for cancer patients, it's really critical to understand what's going on with your bones and get scanned as part of your regular sort of cancer workups. But we don't talk about it enough, whether we have cancer or not. And it's something that we all need to reckon with. So Mo, we have some really fantastic guests. We always have fantastic guests, but we have some
Mm-hmm.
really fantastic guests today. So I'm going to introduce the first one and then we'll sort of go around. But
Fantastic.
Cancer Fashionista. So Melissa, and if you haven't seen the Cancer Fashionista Instagram, you need to go there after the show, but go there. But she's hot. So Melissa is my first TNBC friend. So I think I was a year out from TNBC, and she was just finishing her therapy, and we did a video in Grant Park in New York, right, with the TNBC Foundation, yeah, with the TNBC Foundation about triple negative, and both of us were like still trying to figure out what is triple negative, and we had never met another triple negative patient. So when we were like, wow, you have triple negative too, it was a great day for us. So she's been an awesome friend ever since. And then we have, guess what, our two HBCU interns, two of them. So we have Tatiana, who is a super senior at Prairie View A&M. And we have
What was that again?
she's at
Sorry.
Prairie View A&M. Hold on, you can get your turn, Mr. Alumni, Dr. Keith. And we have Lexi Hardiman. Lexi just graduated from Clark Atlanta University. And so they've been working for us really since like March, you guys, right? And posting on social media and talking about bone health to their peers. So we're excited to hear what they're going to say. And last but not least, we have Dr. Keith Crawford. He's been on the show, one of the few men that we let on our show. Right?
Mhm.
He's a VIP, absolutely.
Yeah.
Well, I'm just honored. I'm honored to be on the show.
Yes.
Yeah,
So he's surrounded by what did you say? He's a thorn surrounded by flowers. What did you say a little while ago?
I said I'm a thorn surrounded by flowers. Matter of fact, a thorn surrounded by roses.
All right. Well, you are.
Yeah.
And you are not a thorn. You are not a thorn. So let's get into it. Melissa, do you want to talk a little bit first about kind of what you're doing, and then Dr. Keith can kind of talk about what you're doing, and then we'll bring in the interns.
Absolutely. And first of all, thank you for such a wonderful introduction. And thank you for this invitation to join all of you today. This is incredible, the work that you're doing, all of you. And I've been telling all my friends to follow. I think this is just such a wonderful platform. So thank you for inviting me. As you mentioned, my name is Melissa Berry. I'm the founder of Cancer Fashionista. Ricky and I met through the Triple Negative Breast Cancer Foundation. And I was a fashion and beauty publicist when I was diagnosed with breast cancer. So once I knew what my course of treatment was, I was basically like, okay, what do I do about my hair when I lose it? When I lose my lashes? What kind of bras am I wearing? And I felt like, where's the Vogue of breast cancer? So I ended up putting together a list. The list became a blog. Blog ended up on Instagram, and here I am today, sharing all of my resources with all of you, and I'm always looking for new ones. So my next venture really has been that I just launched a podcast called Dear Cancer, I'm Beautiful. And I have to tell you, Dr. Crawford right here was one of my very first guests, certainly my first bone health expert guest, because I am doing a series of interviews once per month dedicated to bone health. And special thanks to Amgen for sponsoring this special series. And I'll tell you briefly, even why I became interested in bone health. It's because I'm 8 years out, and just recently my OBGYN said, gee, you haven't gone for a bone health density lately. And I thought, gee, you're the first person that has said anything to me in a few years.
Mhm.
So this opened up a whole conversation. I didn't know, what a T-score was. I didn't know, any of the lingo, and I am here to share all of my findings with my audience, and so that other women like me, when they're first diagnosed, can get a baseline before they even have treatment.
What is
I
a
love
T-score?
that.
What is a T-score? I don't even know what that is, and I've had it on a lot of bone scans.
We'll talk about it. Go quickly, go through it.
With the
Yes, I'm going to let
doctor.
Dr. Crawford answer that. But from a layman's point of view, it really it's an indicator of how healthy are your bones. How are likely are you going to get to have a bone fracture? That's very top line.
And we see so many of our breasties getting fractures. I mean, we just saw Sheila a couple weeks ago, Belle broke her hip in Target, and Shantae has broken several bones, and we don't really, and they probably are getting scanned because they're metastatic, but it happens all the time without us really knowing about it because we can't see what's going on.
Well, and we're less likely to be screened for it, Ricky. And that's because there is this sort of, I guess, a little bit of a dichotomy or a conundrum between the fact that we tend to have higher bone density, right? So when you look at who's got stronger bones, Black and brown women, we think tend to have stronger bones and are less likely to develop fractures, but we still need to be aware of our bone density and learn ways to fortify that bone density because we're not making the vitamin D, right, Dr. Crawford?
Yeah, not as much as from our diet. Our diet has changed, and the fact that I mean, even think about before COVID, we weren't inside, we weren't outside a lot, we weren't out working and getting a lot of sun. We were indoors, so we just haven't been having the opportunity to allow our body to make adequate levels of vitamin D for us.
And how many
wonder if
are drinking milk, right?
Yeah,
not that
but
many.
because a lot, and this was what was interesting, and that's why it's so important to understand I mean, people say, oh, you're focusing on just Black people. I said, there's a physiological difference, and what you'll find is in Black women and Black people in general, there's an increased incidence of lactose intolerance as we get older. And so if we're not going to drink milk, then we're going to be missing a lot of the nutrients needed to keep strong bones.
And now everyone, not to bring a whole other conversation to the mix, but now I find that there are more and more people that are doing plant-based milk. So I wonder, does that
Yes.
deliver the same amount of nutrients that, cow milk does?
I was just going to ask about that because, and what about the lactose-free milks as well? Are you still able to get the vitamin D? And after we answer this, I definitely want to talk to the interns to find out what do they know about vitamin D? What have they been hearing about it? What has been some of the research that you've been getting about what young people and just the general public understand about bones and vitamin D and how it all works? But let's talk about the different milk products first, Dr. Crawford.
Well, the one thing is as long as it's fortified, then you can eat it or drink it. And then if you're looking for calcium from your milk. Now you're not, if you shift away from your milk products, and I even, you shift away to oat milk, almond milk, no, it's not going to be like as good as regular milk, even if they supplement it with calcium in those products. So no matter how you look at it, your diet may not, because you would have to not drink milk, you would have to drink a lot of milk. So as we get older, our diet has to be supplemented with some calcium and vitamin D.
Wow. Wow. So Tatiana, talk about what you learned. And kind of our internship is kind of a social media based internship, guys. And so we asked our interns to kind of start their internship off with polls and asking questions to kind of get a ground floor of where people, if they deal with, are thinking. Sort of like, okay, sort of where are you now? And then over the course of 10 weeks, they post and try to educate to see, okay, now where are you at the end? So talk about what you did, Tatiana, a little bit, and then we'll let Lexi go.
Well, so one of the key things that I was responsible for doing, as Ricky mentioned, was creating polls and, really discussing some of the preventative measures that can be taken to, as far as early detection in breast cancer and bone cancer. And so one of the things that I found really interesting that I learned during this internship was that there are some things you can do to prevent. Before this internship, I knew cancer could not be passed from person to person. And so because of that, I thought that there weren't many things you can do to prevent it. And so throughout this process, I learned that there are things such as incorporating more vitamin D into your diet and exercising, getting up, making sure you're moving your bones. That can help and serve as a great preventative measure to and aid in your bone health.
Great. So what do you think your peers knew about this before you started talking about this?
So before I started talking about this, many of them, they just knew that it was a cancer that occurred in bones. I had some people even slide up and tell me that they didn't even know that cancer could occur in your bone, that they thought it was only formed in your tissue. So I thought that was really interesting to talk about with some of my peers. I definitely do see some of the progress and the effect that it has reached my peers. And so in our day-to-day conversations with some of my friends, I think it's interesting. They'll ask me a question or two. Hey, what was that you were talking about in your story? We'll have many conversations. And so that's something that I really enjoy doing now.
And what's your major, girl?
Biology.
That's fantastic.
And what do you want to do when you grow up?
Becoming a pediatric anesthesiologist.
Wow.
See,
All
I
right.
thought you were going to be an orthopedic surgeon.
She's going to have the DR period. That's an MD at the end. That's all.
Yeah, okay.
Right.
Right.
That's okay. Okay, Lexi,
So
Miss Graduate.
Mhm.
Hello, everyone. My name is Lexi Hardiman. I am a proud alumni now of the illustrious Clark Atlanta University, where I studied biology with a minor in public health. A few things that I learned over this internship were honestly so much. I do have breast cancer that does run in my family, and coincidentally, when speaking with Miss Ricky the first time, my grandmother and her both had triple negative. I had no idea. I called her up and I was like, what breast cancer did you have again? She's like, yeah, triple negative. And I'm like, what are the odds of that? So just really researching it and learning more about it and being able to pass that information on to my friends, and also just general social media people as well. A lot of people weren't getting mammograms, at the age of 21, 22, they say, oh, you're still a little young. No, people are getting it younger than 21, 22. So get that appointment in. You don't have to be 40 or 50 years old to start checking your breasts. So, and then even at home, care as well. I put a few polls up as well, just asking some of my peers, did you know this? Did you know that about the risks that Black women had as far as white women did as well? And they had no idea. I have a poll here. 20% said yes, they knew, but 56% said no. So that just kind of goes to show you that a lot of people really don't understand or realize that we are at a higher risk of getting this disease, and we die faster and quicker from it as well. And then to piggyback off of Tatiana about bone health, vitamin D, known as my professors call it like the sunshine vitamin. It's definitely something that we need to look into and the importance of it. I know there's a lot of companies, like you mentioned, Black Girl Sunscreen, who are starting to try to, reach out to Black women about the fact that, we do need sunscreen. Although you're not spending time necessarily in the sun, that UV light is real. You spending time outside in general is real, and it can definitely catch up to you over time. And then especially with bone health and vitamin D and nutrients with COVID, a lot of us have been just sitting in the bed in the house, not really being that mobile. And especially if you're a cancer patient, sitting in the hospital is really just, on a prone level, it's not really getting much activity. So just really portraying that and letting everybody know the importance of it and to get attack of it early before it's too late.
And have you heard a lot of news lately about vitamin D and the immune system? Do people understand how that works? Do you understand how that works? Do your peers kind of get it? Because I don't think most of us as adults and even as physicians even fully understand all of how vitamin D works in the immune function, right, Dr. Crawford?
Exactly.
Yeah, and that is correct. That's all I can say about it. What they're finding out right now is there were reports at the end of the year that people who are vitamin D deficient were more likely to die in the ICU from COVID infections. And vitamin D deficiency is not something that's new in African Americans. Vitamin D deficiency has been talked about by the NIH. They had symposiums back in 2018 talking about vitamin D deficiency in Black people. So yes, vitamin D is extremely important, and it's important for us to have along with calcium to keep strong bones.
Mm-hmm.
How do you know? How do you know where you can't see your bones, and you can't see what vitamins are in your body. Like, how do you know, and how do you keep track of it? How do you stay on top of it? I'm in the sun every day, and I don't know how much vitamin D I have. I think it's good.
Well, on the average person who has no medical problem. So I put together a list. If we want to, let's see, I was thinking about this. If we look at these general categories, cancers, these are diseases and conditions and medical procedures that can affect your bone strength. Cancers, breast and prostate. Digestive disorders, that's when we talk about lactose intolerance, celiac disease, inflammatory bowel, diabetes, okay? Sickle cell disease, a lot of people didn't know that sickle cell disease could play a role in it, along with leukemias and multiple myeloma. Medical procedures like gastrectomies, or just where they remove a portion of your stomach. And this was very interesting. Neurological and diseases or neurological problems or disorders like a stroke or spinal cord injuries influence your bone density and strength. Mental illness, radiation, even chronic diseases. So there's so many different things out there that can influence your bones. And we already know, what do we know? Your bones support, think about it. I don't want to simplify it to a clothes hanger and a shirt or a coat or a dress, but your bones support your muscles of your body. They give you structure, shape. They give you that swagger I talked to Melissa about, how people move and how it's important. And then when we think about it, we reach a point where you have to focus on nutrition, regular exercise, and your lifestyle. And vitamin D and calcium are very important for women to supplement on. And regular exercise, and we're talking about more resistance exercises, weight-bearing exercises. So, the brisk walk that one may have daily is very important. Resistant exercise, even weightlifting, very important. And then one thing about your lifestyle change is that I'm not saying don't drink alcohol. I'm just saying that at a minimum, maybe 1.5 glasses of wine a night. And then anything above that start to impact your bone health. And I'm always anti-smoking. So the smoking can also impact your bone health.
It's interesting when Dr. Crawford, when you use the analogy about the clothing hanger, because that's something that we talked about during our interview on my podcast was, you could spend all this money on your hair and your nails and your makeup but if your bones aren't healthy and you can't move and you're going to fall and hurt yourself, what's it all for anyway. So it really, like, bone health is really truly the foundation of our health. I mean, it's such a important piece of it, because without healthy bones, cancer or no cancer, it's a very serious disease when your bones are deteriorating.
Yeah. And it's like a lot of people don't recognize, and it's, even if we step back, and Dr. Mo brought up a very important point. Before cancer, there's a disparity in Black women being diagnosed with osteoporosis, because it's always thought, well, Black women are stronger, and so they can't suffer from osteoporosis. But that's not correct. And just some tips talking points were osteoporosis, to give you the definition, is just a condition where your bones become weak, less dense, and they're more easily placed in a situation of fracture. 8 million women and 2 million men suffer from osteoporosis.
But can you feel it? Can you feel it? Like, how do you know it's happening?
Well, it's you said it earlier, it's kind of a sneaky disease. I mean, you don't know until you have a fracture.
There can be some physical changes. I remember watching my Nana, right? She was, when I was younger, she seemed an awful lot taller. And part of it is that I got taller and she seemed to get smaller. But we also noticed there are postural changes. We noticed the way that our hips sit, the way that our clothes can fit, the way that our back can begin to sort of hunch over. And those are kind of generally later signs that there's loss in bone density. But yeah, you can definitely start to see some signs as we age. Now, in the instance of cancer patients who are taking, estrogen blockers that by their very nature decrease the bone density, it's not always so obvious,
And that's absolutely right. And the only thing, if you want to catch it early, then especially for the cancer patients, and Melissa brought up a key point, 8 years later, they start talking about your bone health. When it would be different if the doctors were worried, said, "Oh, I just want to treat them for cancer, and hopefully they'll live 6 months." Nobody's worrying about bone health at 6 months if you're passing in 6 months. But now we've evolved with these new technologies, new treatments, that women are living longer, and after being diagnosed with breast cancer. So that's why it's important, why your message is so important today, to get women who are newly diagnosed is to talk to their doctor about their bone health. How do you protect it?
And the reality is, it's always easier in hindsight, right? Like, when you're diagnosed with breast cancer and you have all of these treatments and surgeries ahead of you, and someone's like, and by the way, you need a bone scan, it's like every little thing you add could be so overwhelming. But if it becomes part of the conversation with the treatment, and I think that is, hopefully more and more doctors will bring it into the conversation and make it really a part of the treatment. Like, before we start, let's get a baseline and see where your bones are at. But I could see both sides, because from a patient, it could be, again, it's something else to have to think about.
But the way we talk to cancer patients, or the way that we should, is that we give overviews, right? So you understand the big picture of things, but then we walk you through it step by step. I tell my patients sometimes, I'm an usher, right? I'm like helping you along this journey. And so at different points in the journey, I'm going to stop and point out some things. Over here, you'll see this. Over here, you can expect this. You may take this pill, and here's how it's going to affect you. Even though I'm not prescribing that pill, I'm still sort of priming them for what to expect, what to look for. And I think that, that is an area where doctors can absolutely do a better job. I think we can train navigators, even, former breasties, to begin to talk about and educate women about this, because how often do you hear things like, okay, well, walking helps your bone density, but it's not just walking, right? Because in order for the bones to change their density, you got to like rev up the metabolism of them. You got to break down certain cells inside the bones, and you got to regenerate some new ones. It's like rubbing sticks together for fire. You can rub all day long, but until you get enough friction, the bones are not going to get stronger. And so there's certain exercises that are better than others, more high intensity, more weight bearing, things like that. And I think that we can, as a community, even educate ourselves a little bit better, because the doctors, they're in that room for a finite amount of time, reviewing that pathology, going over those imaging, going over those pills, and they may talk about it, but the depth of how people need to understand how to make it part of your life is where great organizations, like Touch and where information and advocacy like Cancer Fashionista comes in, because you've got a built-in audience who are all trying to figure out what to wear, what to do, what to eat, how to look at products, how to get beyond this. And so I love that you're doing this series and talking about this, because it really does shine a light on it for people to understand it in real time when they're not overwhelmed with everything their doctor just said.
And I just wanted to highlight one thing that Dr. Mo said. There's this not even a new concept. It's naturally comes to certain doctors, and that's shared decision making. And what your program, Melissa, Ricky, educate the average woman to understand the importance of bone. So what did Dr. Mo say? Because the doctor doesn't have a lot of time. So the doctor is not going to be able to bring you from A to Z, but if you're already at Z, you can have that discussion about, well, what do I need to do? Are there certain treatments? Do I have osteoporosis? Do I have a bone scan? Do you have any drugs like Xgeva that interfere with the breakdown of bones? So all that's important. And this is why this type of discussion is so important for all the women who are breast cancer survivors, and for all women, really.
No, Mo, we've talked about so many things in the last couple of weeks. Neuropathy and lymphedema and all these things. And so when you start talking about, another one, like we need a list. We need that list. That's the way we should work on, Melissa. What are all the things that we can get? Because at the end of the day, like we're so worried about staying alive. And then you have to think about bone health and neuropathy and all these other things. Like, good.
Yeah.
Like, how do you keep it all straight, right? So in vitamin D, so I take this, I eat this, I take this. So it's almost like, I don't know that my doctor, and I know that I got bone scans, but no one ever told me why. No one ever explained to me.
Sure.
I just, you got to get the PET scan, you got to get the bones, got to get the brain. You just sort of do it. And you don't really understand what's going on in your body, because you're so focused on the cancer that you can't even think about this other stuff. But we need like the list of like, here are all the things that you should be looking out for and dealing with.
And we can generate that, but it just goes to show you, how much cancer affects everything, right? Your whole ecosystem, your whole body,
right.
Whether it's your breast or other cancer, whether it's your muscle mass, whether it's your appetite, your weight loss, your immune system, your bones, cancer affects everything. And it's not something that people, are really prepared to understand in the ways that they need to, but that's why we got to keep doing this. And it's why a directory and kind of a list would be amazing resources for bone health. Did you know XYZ? And I'd like to ask you guys, we can do a little round robin here. Can you tell me some foods that are high in vitamin D besides milk? Give me some other foods that people can eat and or drink that will help to boost their vitamin D. Because I think that most people, you kind of draw a blank after milk and sunshine, right?
I hope my favorite food, ice cream, is on the list.
That falls under the dairy category. But name some other foods, How about our interns? You got anything for me?
Like our fatty fishes and our seafoods. Those are definitely a good option.
Mm-hmm. Absolutely. Yep. Anybody love mushrooms?
Mm-hmm.
Oh yeah, egg yolks. Mm-hmm.
Yep, I like some salmon myself.
Yes, salmon's a good one. Absolutely. Cheese, I love cheese. It falls under the dairy category, but you know what? Some of us who don't drink milk can have cheese, and it's a great way to get some vitamin D. Yeah. What else for people who have those plant-based diets?
You can do orange juice or that soy milk also. I think you can get some nutrients out of that.
Mm-hmm. Yep, absolutely can. They can fortify it. And for the old school people like my grandmother who loves liver, liver is a great source of vitamin D.
I would not be eating that.
Not one of your favorite foods.
And I throw in some one thing I like green leafy vegetables. for a calcium source. I just throw that in there, like mustard greens.
Yep,
told
that's
you.
right.
I recently spoke to a bone health expert that said for calcium, talk about old schools, she said sardines.
Yeah.
Mm-hmm. Yep. Wow.
Tatiana was going to say something. What were you saying, babe?
Oh, I would say even supplement, you can buy a vitamin D supplement to take alongside your,
Mm-hmm. And Dr. Keith, if people were going to take a vitamin D supplement to, well, I guess one, to boost their bone density, calcium and vitamin D, but then on two, boost their immune system because of things like COVID. Are there some doses that we should be on the lookout for? And is there such a thing as too much?
Well, let me answer the last question first. Yes, there is such thing as too much. But when we're talking the dosages that we're going to talk about right now, it falls into the more appropriate physiological range, because you can have some problems if you take an overdose on vitamins. And I don't know if people even made that comment. So it's very important that we adhere very closely to, one, obviously got to talk to your doctor or reliable source who's going to give you some input. But sometimes they might not give you the correct input because there's a difference between the needs of groups from different populations. But what we can say is well-balanced diet. But women 50 and younger, 1,000 milligrams of calcium per day. And then women who are 50 and above, somewhere around 1,200 per day. Now, these are numbers that are from the NIH. So this is a trusted source. And then vitamin D, anywhere between 600 to 800 international units. But then that is the number for the general population in the United States. But African Americans or people who maybe with darker skin complexions, they need to take a higher level. Now, there are reports or studies that have suggested 27 international units per body or per pound of weight. So then you can calculate it there. And then we're talking about being concerned about taking too much, even as high as 10,000 international units are being taken. It just depends on a person's body weight. And that's why it's easier to go back to 27 international units per pound to really give you an idea.
Can you write that to me in an email and I'll post it in the chat, because I don't.
Yeah, I'll write it to you.
I also want to know what would happen if you do intake too much. What would your body show you, or what would you just throw it up, or how exactly would that work?
Well, immediately, I don't think immediately you would have, but if you take it for a long period of time, well, I mean, there's certain vitamins that you can have some neurological problems, but that's if you're taking a lot. But depending on taking too much of calcium and vitamin D, you may have kidney stone or something like that. So those have been some side effects are associated with. That's why what is very important is if you can stay along that area where it's about 27 international units, this is for vitamin D, and the suggested NIH guidelines for women under 40, 1,000 milligrams of calcium per day, and then if you're over 50, 1,200 milligrams of calcium per day. Is kind of your best way to approach it. And the other thing that's important too with vitamin D, it's not like you can just take a whole bunch of it right now and then your body automatically catches up. Now it'll take you a long time to gradually increase, so you get to a nice level in your body.
You can't overdose on vitamin D.
I'm sorry,
I was just saying, so you can't overdose on vitamin D.
You can, but it takes an awful lot to do it for a really long time.
Yeah.
It's
That's
like
why
sustained.
you don't want to get the gummy ones that taste too good, because then you'll forget.
It's true. We used to have
a snack. It's not a snack. It's just your vitamin.
We used to have a saying in medical school, Dr. Keith. I don't know if you remember this one for hypercalcemia: the stones, bones, groans. and psychiatric overtones, right? So the stones,
Mhm.
the kidney stones, the bones, bone pain, groans, stomach pain, nausea, vomiting, weakness, and then mental status changes. Like if you get
Yeah.
too much calcium, you can really, too much vitamin D, you can have some
Mhm.
changes and some hallucinations and other things going on. But it's really, really hard to get there because most people are so deficient, and our body has
Deficient.
a
Yeah.
mechanism to try to sort of balance that out. I wonder if anybody understands even the relationship between vitamin D and calcium. Like we know that we need them both. Do we know what they both do? Because I think that's something really important for people watching to understand why and how they even work together. How about you, Doc? You want to take that one for us?
All I'm saying is that to keep it at the layman's level, they work in synergy to build. So let me backtrack. There are cells in the body, and there are two types or three types, really, when we talk about the bone. There's one that's called the osteoblast, and we remember that one because it's a B for blast and build. And there are bones called osteoclast, and I remember that one because it's a C and it's cutting. And then the other is just another bone that provides a cellular structure. When we talk about bone physiology, there's a balance between the breakdown of bone and the building up of bone. So the vitamin D and the calcium is required in this building up process of bone by these cells. So if we don't ingest adequate amounts, then the cells that are responsible to build the bones don't build the bones as efficiently. And the cells that are responsible for, if you think about it, think about a brick house, or where you can see the bricks that are stacked up on top of each other. Notice in between it, there's a mortar that's in between it. It keeps the bricks firm so they don't loosen and fall. That's the same way to look at your bones and the cells that play a role. Now, if you don't continually build up with the vitamin D nutrients and vitamin D and calcium nutrients, then the cell that constantly breaks bone down is breaking down more bone than you're building up. So that's kind of I would kind of say kind of a layman's way of describing where these compounds are needed and what role they play in building your bone.
Perfect. Thank you.
Wow.
So how many people go around getting their vitamin D levels checked? And does insurance cover it? Because
That's an interesting point.
many people come and they want all their vitamin levels checked. I have some friends who are primary care physicians, and they're pulling their hair out because people want their vitamin levels checked every couple of weeks. And one, maybe it's not appropriate, but two, insurance doesn't always cover it either. So how do we help people get to know what their levels are?
Now, that's an interesting question.
It's a tough one. But I wonder how many of you, even as, even as a patient myself, I don't think my doctor really sits down and says, okay, well, this is what your vitamin D is, and this is what your vitamin D is. And you can't interpret those things like in a vacuum. Just because you have one low vitamin, you could certainly change your diet and boost the foods to help you build those levels, but I think that sometimes we focus on the number and not always focus on the overall wellness too. So it is definitely a question to ask your doctor, because I think, if you are looking to check routinely, one, it might not be helpful, and two, it's going to be awful expensive. So I think looking at it from a dietary standpoint of making sure that you're getting the minimum daily requirements of things, and then the extra to help the immune system, to help you, if it's wound healing, to make sure you get your protein. If it's your energy and metabolism and you're feeling sluggish, making sure that you get those B vitamins. And so it might be more of a how you feel versus what your numbers are doing even, don't you think, Doc?
Yeah. And then the other thing, the question is, then it pushes everybody to go back to your annual physical. And then during that period of time, there's a window of time where things can be checked, hopefully, during that period of time.
And so many people aren't getting their physicals this year because of COVID and getting screened and stuff for everything. So, we really have to be careful. We really have to be careful and take care of ourselves. And you know, they're kind of lifting some of the rules, but we should be, you know, we shouldn't be not going to the doctor and not taking care of ourselves, you know. Wear your mask, do your stuff, but don't skip an appointment because we don't know. And especially, you know, with cancer patients, can't
Yeah.
take
Mhm.
Does anybody know how bad our shoes are for our overall bone health? Because, you know, I like to wear my 3, 4, 5 inch heels. I like to wear my cowboy boots. And I wonder sometimes if I will pay for this as I get older, in terms of how the shoes have affected my function and my bones. Are
Yeah,
there?
see, but that's an excellent question because it's when you're talking about over time, it's almost like binding your feet and you're kind of changing the shape and the growth of your bone. Now you change the shape of the growth of your bone, then you change your gait. You change your gait, then the mechanics in your hip changes. Now you're more prone to weaknesses on one side or the other and fractures. So just, I'm not saying that, you know, be an alarmist, but the type of shoes that you wear on a regular basis, you know, now and then 20 or 30 years later, you'll start to see just some odd changes in your gait and your feet starting to hurt and your body's not of alignment. So that's again goes back into, yeah, that was a very important point. You're right. And see, here's what, I'm sorry for interrupting, but this is the difference between men and women, because men would not have thought of that in relationship to shoes, versus women have so many different varieties of shoes. You know, open toed, you know, 6 inch, 7 inch heels. I'm like, because that changes a lot of your body mechanics.
Well, I really need to keep my bones healthy because I love my shoes.
I
Sorry.
know,
I'm
and I
just
think
trying to keep
all-
it cute. Yep.
I think we actually got a high heel break without asking for it with COVID. I don't know about you ladies, but I just put on a pair of heels the other day and I was like wobbling. I'm like, whoa, it's been a while, you know?
What?
Yeah.
And my mother always said to me, you don't break in your shoes, they break in your feet. And I always remember
True.
that, right? Like,
Wow.
Oh, I see.
and I
Boy.
think also, like, I would imagine high heels affects your posture. So I would almost be inclined to say, as a fashion person who is also mindful about my health, is everything in moderation. So wear the high heels once in a while, but we don't need to wear them every day. Do you guys agree?
Absolutely.
I think you're right. Yeah. And I hate to agree with you because I love my stilettos, but I have noticed that this year, after not wearing them for an entire year, I've worn nothing but clogs and sneakers and dance goes and, you know, surgery shoes and things that I can bleach or throw away or, you know, that I can disinfect very easily. And I haven't been wearing those shoes. My feet, one, have felt healthier. Two, I've had a little bit less low back pain this year.
Oh,
You know, now that the chair hasn't helped, sitting here zooming all day long, that's a different story. But I have, you know, from walking around and the pressure, right, of walking on those heels, like it does go into your feet. The shock of our weight on those heels is probably not the healthiest thing. So I think you're right, you know, and finding really good, comfortable shoes that also look cute is something that I know that I'm interested in. So whatever you got on that one, whatever you find, you post and send my way, because I have got to keep it cute. But I need these feet for years to come.
Absolutely. I mean, I think a good happy medium is a wedge, and maybe a wedge that is not necessarily too high, but they look really pretty. You still kind of get that feminine arch without all that pressure on the ball of your foot. And I say, save the really crazy stilettos. I call them limo shoes. When you're like kind of in and out of a car, you know, when you're not walking around, you know, the city or have to walk up, you know, if you're valet parking, for example, for dinner that night, it's a great opportunity to put your heels on. So maybe
Love
just
it.
kind of think your night through. I actually did that just recently. I was in Florida and I had the high heels on. My friends were like, we're going to be walking. You sure you want to do that? I was like, you know what? Wedges. So wedges are a good option.
And for men, we've got a really good question about the impact of a wallet. So the thick wallet that a man has, because I mean, you know, you've seen some of these guys, that wallet can be this thick, full of receipts and other things, maybe money too, but lots of times, lots of papers and other things, and it impacts the way they sit and potentially the posture. So we had a man
Yeah.
just to come into the chat on Black Doctor. He said, well, what damage is done by men having a thick wallet in their back pocket daily?
I mean, everything goes back to your body mechanics. So if you're standing up straight, your stomach in and your shoulders up, and that's the way you walk and maneuver, versus we've been in the chairs for such a long time. If your wallet's in your right pocket and you're leaning over here all day long, your muscles are flexed here on the side that you're leaning on, or relaxed, and so you'll strain. You have the ability to strain your musculature, and if you strain your musculature, that's going to influence how you stand. That's going to influence how you're sitting and how you walk. So all these things, if it's not erect, sitting back, and you're not leaning over, you can clearly impact in the long run everything. Your gait is everything. So the moment you start changing the natural gait of the body, you start to impact certain areas of the bone and increase the possible chances of fracture. So
It's interesting that we feel muscle pain, you know, and when our muscles are sore, but we can't feel our bones.
mm-hmm. But can I show you something? I'll show you something, Ricky.
Sure.
It is so this gives you a nice image, because you were talking about, you know, what's going on. So I'm giving you a split image that really gives you an idea of, once you start to get weakening bones, start to develop osteoporosis. So it's called your bone mineral density test, your T-score. So women need to ask their doctors about their T-score. As you get older, the level of estrogen that you have in the body declines. That can lead to osteoporosis. Breast cancer, the medicines that you're taking can lead to osteoporosis, weakening of the bones, as well as the cancer migrating away from the breast to other parts of the body, to the bone. But what's interesting here is your T-score begins at 0 and goes in the negative direction. So if you have a T-score of 0, it shows your bones. This is what your bones look like on this side over here. As they start to weaken, they start to get wispy, thin, fragile. So a term, osteopenia, is a T-score that's less than -1, 2, or -2.5. Osteoporosis, way down here, is a T-score of less than a -2.5. And this is what I wanted to say that was important. For every 1 degree in your T-score, your fracture risk doubles. Regardless of your bone mineral density, after your first fracture, you are 5 times more likely to experience another. How do I?
Wow. So you
I
don't.
always have a problem with this. Where's your? Oh, there we go. Stop sharing.
Wow.
So
Wow.
that's, even though you don't physically see it, but that image needs to stick in your head. It's wispy. You can move from this firm, strong woman. And why we push this, and this is something that Melissa and I were talking about before, quality of life. You have grandbabies. They're jumping on you, wrestling with you, and you get a fracture of your hip. That changes the whole quality of life. You can't do the things that you love to do.
I actually have a couple of friends, new grandmothers, that they needed knee surgery and hip surgery, and they didn't get it until their grandbabies were running from them and they couldn't catch them. And my friend Yvonne, so that was a good reason to get, not only get rid of the pain and make yourself healthy, but to chase your grandkids. But I'm looking at these young girls, though, and we want them to start out in the right place with the right fundamentals and the right way to stay healthy, and also help their mamas and their grandmas. Like, you need to be grandma Lexi, how's her bone? Has she had a bone scan? if she
What's
had.
a bone scan like? For those of you who've had a bone density scan, because there's 2 different things here, because there's 2 different things here, right? There are 2 kinds of tests. So the test you're talking about is a DEXA scan, right?
Right.
So the scan to check for bone mineral density to get the T-score. There's another test called a nuclear bone scan that looks for things like cancer in your bones. So 2 different types of bone tests, but the DEXA scan, for those of you who've had it, what's it like? Does it hurt? Is it just an x-ray? Because there's people watching who've probably never had one and their doctor's like, oh, you got to get a DEXA scan. And they don't know what to expect.
I didn't know what to expect, and it really wasn't very bad, or there was nothing dramatic about it. I put on my robe, and they laid me down on the table, and there was basically a camera that went over me back and forth, and it took maybe about 15 minutes. It was really fast. But this is all about education, because I know my results came back and I read my report and I see osteopenia, and I'm like, oh my God, I got this wave.
Mhm.
And then, now that I'm learning, it sounds like most women my age, breast cancer or not, have a
Mhm.
bit of that. And it's just because I'm turning 50. But I mean, this was
What?
really eye-opening for me.
50 where? 50
Yeah,
who?
what are you just about to say? There's no
That's
way.
it. Hey, no,
I'm gonna be 50 in
Chloe,
August. Oh, you
no.
guys, thank you.
I said, what? I'm like, you must be talking about the lady on the wall in that picture
Oh, you're
behind you.
sweet. I always say it was the chemo.
Right. But you know what else is, and to let people know, it's less radiation than x-rays.
Yeah, it was really a piece of cake. It was easier than an X-ray. It was faster than an X-ray. You didn't have to do anything, and mine took like I think like 10 minutes. It was no big deal at all. So
Yeah, you don't have to drink anything weird or.
no, it's
Mhm.
nothing compared
Yeah.
to. But I've
I
had
think-
the other one too, and it sucked.
Yeah, yep. The nuclear scans are a little bit tougher. I think it's important, though, Doc, that you bring that up about radiation, because people are very sensitive about the amount of radiation that they are getting, as a survivor, right? Just for screening and surveillance. And certainly the benefit outweighs the risk for a lot of things like mammograms and for DEXA scans. But we're talking every other year or so, especially for patients who are on those estrogen blockers, because they can decrease the bone density. And your doctor should be talking to you about, 1, natural ways to improve your bone density and improve your calcium and your vitamin D, and 2, supplementation, so things like calcium and vitamin D. And then from there are even more medications and things that you can consider, other ways to, once you really, or if you start to get into that area of full osteoporosis and or at high risk of fracture, right? What are some things that we can do, Doc, to start to pull ourselves back if we notice that our bone density, no matter how much calcium we're taking, something's still happening there. We're walking, something's still going on. What can we do to improve that bone density?
Well, it's very important that you say that. And, these are the things that we can do. We can have non-pharmacological, non-drug related approaches to slow down. So remember, there's a point I wanted to bring up. You can't reverse it, but we can slow it down, right? So we know about bone protection treatments like resistant exercises, but more than that, there are drugs that play a role at the cellular level. Now, there are 2 that we know of. One is Xgeva or Prolia. It's denosumab is just another name for it. And then another one is zoledronic acid. So one is X and one is Z. And when I bring up these compounds, these bone protective agents, these agents that prevent bone loss, it's very important, and especially that people need to recognize that you have to tell your doctor about your history. You mean, what I'm talking about is your medical history, because there are reports by the FDA that certain compounds like the zoledronic acid are not good for people that are taking diuretics for hypertension, because they can lead to acute renal failure. So it's very important that you have options, and now you have options like Xgeva that, one, they don't kill the bone cells that I talked about before. That bone, it's like an osteoclast, that cell that chops up the bone. It doesn't kill it. What it does do, it's kind of like an immunotherapy and an immune-like molecule that interferes with the ability of that cell to chop down bone. So if you're thinking about some additional therapies to help slow up the bone loss, Xgeva is an excellent one that you should talk to your doctor about, and really get and let them know if you have high blood pressure and you're taking a diuretic, which would suggest that you are having increased probability of having renal problems in the future.
First, you have to figure out if you have a problem. You need to go.
I think that's great advice.
Yeah, you
Yeah.
gotta get your T-score.
Yeah, and so for people who are watching who are on estrogen blockers, one, for the younger women on tamoxifen, is this something that they should be concerned about?
If
Not as
you are,
much. Mhm.
if you're on compounds that influence estrogen levels, then you need to start talking to your doctor about your T-score, your bone scan, your bone health. It becomes your priority after your diagnosis, because if you fracture, you're going to fracture again, and it's going to change your quality of life. And this is
Yeah.
something that I always say: women give life, their mothers, they go to work, then they take care of their family. There's so much on your shoulders. And I'm not saying that sometimes you got to take that cape off and fold it up and let somebody wait on you. But the point is, you have to have healthy bones, because a lot of people will depend on you. And that's so important. I just say it because it's true. So the moment you have a fracture, then it weakens your bones and your chances of having more fractures increase. So I just want you guys to stay healthy, even though y'all look real good when you got healthy bones.
Mhm. All right.
Lexi, have you started talking to your grandmother about her bones and her bone density? Do you talk to your family about it now?
I actually have not been able to mention, I haven't spoken to her in a few days, but I definitely will call and ask her about it. I know from just previous experience, she hasn't ever had a fracture, no hip fractures, but her friends have. And we were just talking about one of them, and it definitely has. She's noticed, she's less active, doesn't want to talk as much. It also takes a mental toll as well. Like,
Yeah.
you experience this big life change, and it's just like, well, now what do I do? And how do I know my friends aren't going to see me as the needy one, or the one that is just a drag? So yeah.
Yeah, and you start to feel older, so I got to ask my always question, because I believe that Black breast cancer is a different disease. Is this different for Black women, Dr. Keith, or is this different? Do they have different bone issues? Do we get it worse like we get everything else worse?
Well, Black women get it worse because it's not diagnosed as much as with white women. It's 50%, it's diagnosed 50% less. And that is,
less?
yeah, half, yeah. So if you were to, at the same age, the same group, and then if you had something that we'll talk about later, it's called a fracture assessment, Black women would fall in that category, but their doctor is not discussing it with them about osteoporosis or T-score or anything else like that. Black women develop osteoporosis.
I hate that stuff, right?
I said, but here's the point. You're right, but you are educating all these women to go in. What's my T-score? Because the physicians may have a perspective on, well, Black women, in some medical book in 1985, they wrote that up, and it doesn't change until you guys, the doctors in touch, and in Cancer Fashionista, talk about bone health, because women need to be educated about how important it is. And doctors don't, that's not part of the discussion. 8 years. And now all of a sudden, we talking about it now.
Yeah. Melissa, I bet you TNBC people get it worse too, right?
Yeah, I don't know, but it was definitely eye-opening for me. And I think to your point, especially, about Black women, we need to balance the scales. It's just not, it just doesn't even make sense. And I'm just so glad that we're having these conversations about bone health, just in general. Like I always say, cancer or no cancer. I mean, even I have friends that are tuning into my podcast that never had breast cancer, and they're like, you know what? I think I need to go get that bone test. So, I think it's just important for all women to be, even my daughters, they're already, I mean, they're young, but just for them to even know that osteoporosis is not an old lady disease.
Yeah.
Boy, say that again. Say that again.
Osteoporosis is
Yep.
not an old lady disease. I thought it was. That's like a grandma disease. With a
Right.
little cane and no.
Mm-mm. No.
Gotta take care of our bones.
And as long as we maintain the nutrition, the exercise, and regulating lifestyle issues like smoking and drinking, and that's very important to slow the progression of osteoporosis. And we do have drugs, therapies that help slow the progression, especially women who have osteoporosis, and then women who have breast cancer or receiving treatments that impact or cause bone thinning also.
Well, we dance every Friday at 3:00.
See, that's what that's a start.
I'll put the link in the chat, but we dance every Friday, 15 minutes.
That's
Because
it, dance for your
bone
bones.
health can be fun too.
Right.
Yeah.
Absolutely.
Makes it fun.
We have a Love Your Bones dance party every
Mhm.
Friday. And the first Saturday, we
Absolutely.
do a Love Your Bones
Yeah.
a walk. So we'll put that in the chat.
Yeah.
Lexi, you had a question or?
Yeah.
Yeah, I was just going to ask, with people with, like you said, it's not an old lady disease. At what age, I guess, could you walk into a doctor's office and them not look at you like you don't need to worry about that, or you're too young for that. Don't worry, and you might shrug it off, as a 21. Oh yeah, no problem. But in reality, how would you counteract that?
Well, this is the concept around shared decision making. And when we're talking about breast cancer, I think personally, that we need to be educating. And that's why I was so happy we had the program with the different colleges, educating women at age 18, when they leave the house and they're in college, talk about your breasts. Because these are discussions that normally you didn't have at home with your mom. Now you're in college, and women are having all these questions they need answered. They need a reliable source. So touch becomes Doctors In, Cancer Fashionista become reliable sources about your body and about a critical disease that can impact women, and that's breast cancer. So the earlier you can learn about it and be prepared to have that discussion with your doctor, because your doctor can say no, but you govern your body and they are your consultants. And then let's talk about how to keep me healthy. Do I have a family history? Do I have a genetic background? If the information is here, and don't let them shrug it off. Now, 30, when we move from cancer to osteoporosis, and it just depends on your lifestyle. But if you start going downhill at 30, I mean, what I mean by going downhill is estrogen levels start to decline. I mean, around 30-ish. So, but again, everything goes back to that's your body. You're educated about how your body works. And then you have a trusted resources that you can always tap into, because information is not static. It's ever evolving. Whoa, a year ago, nobody said anything about vitamin D in COVID infections. And now people are writing blogs and articles about the impact of vitamin D in protecting you.
Yeah.
So you just need to focus on you've already identified reliable sources in front of you.
And I think it's important to listen to your body, because when you are younger, unless there's some predisposing reason, your bone density is not going to decline into osteopenia or osteoporosis at 20 something. You know what I mean? Something a kidney disorder or some other issue would have
Yeah.
to be kind of going on, and you might have some other symptoms. You might have some bone pain or some sluggishness or some your body's going to give you some signs or symptoms when you're at the age when your bone density still should be increasing if it starts going in the opposite direction. So I think
Mhm.
listening to your body, knowing your family history and talking about these things, because you know, I had a patient just last week who had osteogenesis imperfecta in their family. Like they had a bone
Mhm.
disease that's a potential hereditary bone disease in the family, and nobody talked about it. It was just the uncle who, you know, had the bone thing. And those are sort of the things that you can do, especially at your age, to kind of
Yeah.
make sure that these health issues are on your radar so that you'd even be checking for them. So asking about, you know, why is Uncle so-and-so in a walker, and does he have osteoporosis, and what other things run in our family? And, you know, Nana, how often do we get checked for these things? So I think it's good conversations to have, to just become aware, you know, and
Mhm.
then monitor how you feel. If you have persistent pain in your bones or other sorts of things, you find a doctor who takes you seriously about that and figures out whatever the cause is. It might
Mhm.
not be osteoporosis, might be something else. And that way you can kind of partner with your doctor, like Dr. Keith said. That is great advice. You know, the most powerful thing you said was that we're the consultants, we're the advisors, but you are the master of your body and your health. Like I absolutely love that. We ought to put that on a t-shirt,
I know,
Doc. That's
a t-shirt. Yeah.
the ball's in your court as a patient and as a person who knows your own body. So that's powerful.
Yeah,
Very
and,
powerful.
and you know, that's why you are doing this internship, Lexi and Tatiana, because we see so many cases of young women not being taken
Mhm.
seriously by their doctor for breast cancer. Oh, you're too young, it's a cyst. And so we want you to learn to stand up for yourself, and you can fire the doctor even at your age.
Mhm.
You know what I mean? And say, wait a
Mhm.
minute, you're not hearing me. I know something is not right, or I need to be checked, or I want this scan, or I
Right.
want this. And if they don't give it to you, go find another doctor. But it is, the ball is in your court, and it's so important for you guys to know that.
Yeah.
And it's about listening too, you know, because if you have an issue, so the most common thing that we hear on our show are young women with breast cancer who had a lump and their doctor said, oh, it's just a cyst. And they didn't look at it. They didn't do an ultrasound. They didn't work it up. They just assume because you're young, you have a cyst, you know? And so you want to make sure that you listen to your doctor and partner with your doctor as well, because people do come with a lot of things. They'll come with a laundry list of things that they want,
Yeah.
but they won't know what to do with those results. And those results don't mean anything for their health either. And so it's definitely a two-way street in a conversation. And most of us don't feel empowered enough to even have that back and forth with the doctor. The doctor says this, and then they walk out of the room and you're
Yeah.
like, oh, I had 5 questions. Darn. I didn't
Mhm.
even get to ask those questions. And so empowerment looks like, okay, doc, I hear what you're saying, but how can we be sure? Is there a way that we
Mhm.
could look into this further?
Right.
Or, oh, wait, I got my questions in my cell phone. Can I just ask you a couple quick questions? And that's what empowerment looks like, and advocacy looks like. It's just saying, hold on, doc, before you walk out of that room,
Yep.
can we have a conversation about this? Because they're just people, you know,
Right.
with a certain skill set and a certain level of expertise.
That's
And a lot of
exactly right.
times when you partner with your doctor and remind that doctor, like, hey, person, not a number, not a lab, not a diagnosis, not a tumor. There's a person attached to that.
Right.
They'll sit down and they'll meet you eye to eye, and you'll find that they can be very reasonable.
And you guys, when you become doctors, you have to do the same thing from the other end. And Lexi, we didn't even say
That's right. That's right.
What are you going to do now, girl?
So as of fall 22, I'll be going into medical school, and my end goal is to become a board certified dermatologist.
Woo!
Mm, okay.
Fantastic.
So
And on that note, the American Academy of Dermatology does recommend sunscreen for Black and brown people. And I know we were talking about this a little
Okay.
earlier.
Yeah, I was wondering.
Yep, they do recommend it. One for, of course, risk reduction for cancer, but also, you know, for general wellness of the skin, you know, sunspots, things like that. We tend not to get as much of them, but you know, the proverbial saying that black don't crack is not entirely true, because
Wow.
it does, and because when we do get skin cancer, we get it worse, right? How many
So,
textbooks have you
yeah.
seen with skin cancers in Black and brown people,
Yeah.
right? No,
It's
people
very,
aren't
it's
checking.
very aggressive.
Yeah,
And
it
so,
can be more
and then
aggressive.
and so checking the skin, I'm just gonna crack a joke. I said, well, you mean I can't use Vaseline no more? Because he's like, you would talk about ashy elbows. I said, like, my elbows, I put some Vaseline on them this morning.
What
But
happened?
yes, but now I've learned,
Yeah.
because I was using some Vaseline and some lotion
Oh,
to
that
keep
doesn't.
it, to
Yeah.
keep your skin moist.
Not
No.
so much, but picking safe products, Melissa, this is where we
That's
need
right.
you so
That's
that we can
exactly
learn how
right.
to even evaluate the ingredient list
sunscreen.
on the
Yeah.
things that we take in.
Mhm. Because
Absolutely,
it's
because I mean, your skin is your largest organ. You're drinking it basically.
mhm.
Well,
And it
Melissa,
was
that's
it
another
was
show. That's another show. We need to
that's
do
another.
sunscreen.
It's very important also is that a lot of people look at the terms that they threw around, organic. Okay. It's organically made. The problem is the active ingredient is organic, but the preservative isn't. And a lot of these preservatives are like pesticide based. I'm talking about the only reason they have it in there is to decrease bacterial growth and prolong the life of the cosmetic or the compound that you use on your skin. So that should be and then you should really, that whole concept is going to be important for talking, opportunity to talk about breast cancer and these ingredients like parabens.
Yeah, that's a whole
Also,
other conversation. You know, we need
yeah,
to really
you
focus
gotta,
on beauty products, Melissa. We should, because you're the guru on that.
you
So
Google.
Absolutely, that we could do a whole other episode. I'd be happy to.
yeah.
Fantastic. I love that. I gotta just say, Tatiana, your family is in the chat on blackdoctor.org, and they are lighting it up with interesting questions, with facts that you have brought to them, with just good feedback about the experience that you've had and how it's opened their eyes just by you sharing this program. So kudos to you, Lexi. Kudos to you, because you are showing young people that there's a place at the table for these conversations. Like, you guys belong at this table. You don't wait
Okay.
until you get your degree. You can start right now, educating people and explaining things in terms that people can understand, because once you get to a certain level, it gets a little bit harder to try to use the words that people need, but you guys are that connection. And it's so necessary. So hats off to you and the internship for the powerful work that you guys are doing. It's amazing.
Yeah,
Thank you.
and that was what's so nice about it is they go to a center of excellence, academic excellence, and then you take that home to your family, but not just your family, your community, your church, because you become that resource as well. Didn't you talk to me about bone scans and bone health? That's what we're supposed to be doing. The
Yep.
tide raises all boats.
Yep, the tide raises all boats.
I
We got
was-
to go, Mo. We hate this happens every week. We hate to go.
Oh, it's over. I can't. It does go fast. You were right, Ricky. It goes so fast.
It's so great to have all of you guys here. And
Thanks for having us.
yeah, and Lexi, I want to talk to your grandma about triple negative.
Absolutely.
We do that. But,
And I was actually just going to mention, like what he said, bringing it home to our communities. Some of my grandma's church members and women's organizations and stuff like that. She's like, we're having a Zoom call. Can you come on and speak to us about, what you've been doing? Because of course I always talk to my grandma, and she's like, I'm like, yeah, let's do it. So I'm excited to spread that information and just let everybody know, it doesn't stop. It's always going to keep going.
I love that. Wow. So really quickly, how can people reach you on social media for more information, for more of those polls, if they want to encourage their young people to participate in polls, things like that? Let's do a quick round robin. We'll start with Melissa.
Thank you so much. You can find me on Instagram at Cancer Fashionista. I'm on Twitter at Cancer Fashion, and my website is cancerfashionista.com. And most recently, my podcast is Dear Cancer, I'm Beautiful, and it can be found on Spotify, Google Play, Stitcher, and Apple Podcasts.
Wow.
wow, you go, girl.
Thank you.
And Tatiana.
You can find me on Instagram at Tatiana McLean. It's my first and last name.
Great. And you have more studying to do, so you have a little more work to do before you, but so proud of you.
Thank you.
And Lexi?
And likewise, you can find me on Instagram at Lexi Hardiman. I'm on Facebook, LinkedIn, anything, all under Lexi Hardiman.
Right. And Dr. Keith?
Well, one, I'd like to say thank you for allowing me to have another opportunity to share my evening with you ladies. Okay. And I can be reached at kcrawford@prostatehealthed.org, or you can just call us, and I'll always call and or text you back, or call and email you back. So if you have family members who men who have, or men, Black men in general, should be screened at age 40 and on. So if they need someone to talk to about prostate cancer or their concerns about screening, you can contact me at any time. I'm 24/7, just like Ricky. Because this is what's so important is that these are major cancers that impact Black men and Black women. And one of Ricky's shows brought in a Black man who had prostate cancer, whose wife was taking care of him, and then she ended up having breast cancer and another cancer.
In the same house.
So we're in the same boat. And so it's important for us to both support each other.
Absolutely. Ricky, we can find you at touchbbca.org, right? And on the Facebook
Touch
group.
BBC.
Yep.
Yep.
And our Facebook group, Touch Talk. We have a new Facebook group, and I put our walking and our dancing in the chat.
Fantastic.
We dance every week. We walk every first Saturday of every month, and we're going to keep our bones healthy because I'm wearing my stilettos. I'm not giving them up.
I might trade mine in for cowboy boots a little bit, but I'm still.
Well, see, that's what I'm
gotta
talking
do it.
about. That's what I'm talking about. That's that Texas style.
There you go. That's right. That's
We
farm
have
life.
some good boots in Austin. If you get to Austin, we
I'll
have
be
to get
down.
you some boots. Boots and
Sounds like an
barbecue.
invitation.
All right.
Don't threaten us with a good time. We will
Okay.
travel for shoes. Once
I said
COVID's over,
I said
you're going to be meeting all of us for shoes.
And you need to come down to Prairie View.
Yeah.
Beautiful.
And
Wow.
stop
And
over in Clark. Don't forget that.
that's right.
So,
There it is.
So Mo,
Yep.
tomorrow is International Clinical Trials Day, and you know that's my passion, right? So our next week's show is going to all be about clinical trials.
Good. Let's do a little video tomorrow on it too, just to kind of remind everybody to keep it on their radar, because this is something that's sorely needed in our community, and we should all be talking about it and asking about it, and no longer be ashamed of
Yeah.
it or feel like, that's something for somebody else and not for us, because
Yeah.
it is very, very much for us too. So we definitely got to talk about it. So that's going to be a great show.
And
then our
remember
next
that
after
there's three C's about it. Cutting edge technology. It's like a concierge healthcare,
Ooh.
and no cost.
All right.
All right, we got
VC. So I'm gonna
I
let y'all
love that.
talk about that next week.
All right, we'll talk about it. And then the
Love
next week we're doing our Pride show.
Yes, we are. We will
Oh.
be covering Pride, LGBTQ health, and cancer. And I think we're going to try to do something all month long, because the entire month of June is Pride, and it's a conversation that we need to be having, especially in the Black community, about health in the LGBTQ community.
Right.
And so we're excited about it. We got some good stuff coming up. I'm Dr. Monique Gary on all social media outlets. You can find me on the LinkedIn and Twitter and the Facebook and the Instagram, and I'm going to get on the Clubhouse, I promise. But we hope this has been relatable, reliable, and real, is what we set out to do every single Wednesday night. And so the doctor is in. Thank you for joining us.
The doctor's in.
Thank you.
Thank you for having me.
Rusty
Bye.
Absolutely. Oh,
Rusty Levelish. Rusty
gotta
Level.
do the heart.
I got it.
All right.
Here it is. Take care,
Bye.
everybody. See you next week.
Thank you so much.
Bye, guys.
Thank you.